Okay, so questions. Yeah, sorry I'm early. First question here, which I've got, says, I am due to have a stoma. Do you advise having a mummy makeover before having my stoma or afterwards? If I end up having an emergency stoma, how long until I can have a mummy makeover? So definitely the answer to that is have the mummy makeover before the stoma, because it is very well, I'm assuming by mummy makeover you're including a tummy tuck on that, because the tummy tuck is the important aspect if you have a stoma. So a stoma, if you don't know, is an area of the bowel that is exteriorized on the abdominal wall. So you have a bit of the either the ileum, which becomes an ileostomy, or the colon, which becomes a colostomy, and it's exteriorized on the outside of the abdominal wall. And because I've previously been asked if you can have a tummy tuck if you have a stoma, and the answer to that, the kind of easy answer to that is no. You'd have to have the stoma refashioned, and there'd be a big risk of infection because the stoma is kind of dirty, if you like. When we do plastic surgery, it's always clean surgery because we're not doing anything where we're entering a body cavity or the bowels or anything. When you do surgery, when you're entering a body cavity or the bowels, it will be then classified as dirty surgery, which has got a higher rate of infection. And infection can be a real problem with tummy tucks. So you, to all intents and purposes, you can't have a tummy tuck if you have a stoma. So if you are thinking, or if you are potentially going to need a stoma in the future and you're thinking of having a tummy tuck, the order to do it in would be to do the tummy tuck first. And then once you've had the tummy tuck, that's fine. They can make the stoma in the in your abdominal wall, in your kind of new abdominal wall, if you like. But if you have to have an emergency stoma stay, say, and you say, how long can I have until I have a mummy makeover? I would say if you have to have a stoma, I would say don't have a tummy tuck. It's just too difficult, or at least it would need a lot of organization, because there need to be organization between your plastic surgeon and your general surgeon, and the risks would have to be discussed, because they would be increased, and to the extent that whether it be actually a viable option at all. So definitely have your tummy tuck first, then your stoma. I'm on the south coast. Are you too far away to travel for surgery such as a thigh lift? We do treat people from far away, and we treat people from south coast, London, Scotland. I always advise you to go close to home. That's always my advice. If someone wants to ask, should I have surgery close to home, I would always say yes. But having said that, we do operate on people who live far away. But ideally, if you can find a surgeon that you can trust and work with, there's certainly a lot of fully trained plastic surgeons about. My recommendation would be that you find someone closer to home to do your surgery. But as I say, we do operate on people from the south coast and from around and about the country. And we could certainly have a discussion if you wanted to. But yeah, if you're asking my advice, look for someone close to home. How do patients travel back okay after thigh lift surgery? Aware from research, it says be careful sitting, standing, and walking. But how would one get in and out of a car safely after surgery? So yeah, you have got to be careful with those things, but at the same time, you still got to do those things, and it is good to move. So there's always a balance in terms of the wounds, and maybe the wounds not healing up properly, and putting too much tension on the wounds, versus everything slowing down, particularly in terms of DVT, PE, clots in your legs that can fly off into your lungs, which is a risk with any surgery. And so those risks are lessened when you're moving. So I would say to you, it is actually good to move, and it is good to walk about and stay mobile. The thigh lift is not too bad. The scars are kind of on the inner aspect of the thigh, so you're not actually sitting on your scars when you're sitting. So I'm not sure sort of how careful you have to be for sitting. It's okay to sit with after a thigh lift. But the main thing I would say is the immobility. So that's the thing about traveling back after a thigh lift. Keep your legs moving when you're in the car, or or whatever. Just keep everything moving, keep taking deep breaths, keep the blood circulating, you know, perhaps have a stop and a walk around, because DVT is something we worry about. But to be honest with you, that's the same with any big operation. It's not exclusive to thigh lift, and actually when you're sitting, I don't think you're any, you know, particularly more pain than perhaps something else, although it is, you know, fairly big op and the thigh does feel tight, etc. But you should be okay traveling back after a thigh lift operation. Usually do go back the next day after a thigh lift anyway, so you have a night in hospital. Can a patient who has had previous varicose veins have a thigh lift? Yes, for sure, for sure. Absolutely fine. If you've had previous varicose veins, you can have a thigh lift. That's okay. They will have stripped or destroyed your superficial veins during the varicose vein surgery, but that will be fine to still then go ahead and have a thigh lift, no problem at all. My BMI is 32, but I do not want to lose weight because I would like breast implants. Oh, sorry, but I do not want to lose weight, but I would like breast implants. Would you operate on me with my BMI being 32? It's hard to say this sort of thing on a video without knowing anything about you or your situation. I think it would be an unusual situation to have a breast implant at BMI 32. BMI 32, usually the breasts are quite large, so usually the sort of surgery that people are asking for with higher BMIs is kind of like breast reductions, breast lifts, things like that. And it's unusual, probably not unheard of, but it's unusual for just breast implants, because often when everything gets bigger, everything gets stretched. And so there may well, I would imagine, although as I say, I don't know anything about this patient, I would imagine the breasts have been stretched, and I would imagine there's an element of droop to the breasts. So then that rears the head thing about lift. Would a lift be needed as well as implants? And when you start doing a lift and implants, then you start thinking of increased complications, because that's quite a big operation, and that is increased with a BMI over 30. So the higher BMI is higher risk of complications, and a lift with implants has in itself got a high risk of complications. So it's one that I would be anxious about just from that sentence. I would be thinking, I don't think this is a kind of great candidate. Someone who's got a BMI of 32, doesn't want to lose weight. It's an unusual situation for someone who would be having breast implants in my practice. But as I say, I don't want to sort of, perhaps if you want to maybe email and send us some photos maybe, and I can give you an idea to save you coming for a consultation. But it is difficult to give complete advice without knowing you and examining you, etc. But just based on that, I wouldn't be thinking you're a great candidate for a breast augmentation, but never say never. Hello, this is on Instagram. Hello, do implants move if you have children after breast surgery? No, what actually happens, Zoe, is your breast moves. That's the problem. So the implants tend not to move, but when you have children, what happens is your breasts get bigger, and then usually they then get smaller. So they often get bigger when they become engorged with breast milk, and then when they get smaller when you stop breastfeeding, and that can cause your breast to droop. And often the implants kind of stay where they are, and your breasts fall off the implants. So your breasts droop, and the implants don't. It's not actually the implants that move, it's your breasts that move. So that can cause dissatisfaction and can cause a shape that you might not be as happy with as you were previous to children. Children can change the shape of your breasts and the size. They can get bigger after breastfeeding. Sometimes they get smaller after breastfeeding, but yeah, breastfeeding can have an effect, but it usually has an effect on your breast rather than an effect on the implants. The implants are usually kind of sitting there and your breasts kind of fall off them. That's the usual situation. Thanks, Zoe. Could I have breast implants if I have been diagnosed with Chiari Malformations? I do not need to have surgery for the condition, but I do take Pregabalin. Well, any time someone has a problem, a medical problem, I would always kind of liaise or lean on your doctor looking after your medical problem. So I mean, I've heard of Chiari malformations. I think it's vascular malformations in the brain. I think. Pregabalin, I don't know if that's an anti-epileptic. Is it? I'm not an expert. I'm on the edge of my knowledge here. I'm not sure. The main thing for me is I would kind of be looking to see if you are fit and healthy and able to get about your daily activities. If you are not, if you're having a lot of problems with fits or have any problems with your daily life, then maybe we would think twice about surgery, and we'd have to discuss that with anaesthetist. To be honest, you probably have to discuss it with anaesthetist, whatever. But if you are able to get about your daily life without too much impairment or impediment, then you would probably be able to have breast implants. But we would normally, or I would normally, or whoever it was you saw would normally write to your GP and normally write to your doctor who's looking after your Chiari malformations to say, look, this patient's thinking having breast augmentation, takes about an hour under general anesthetic. Is there anything we need to do? Is there anything we need to optimize? And, you know, are the medications stable? Is it a good time now? Or if not, can you help us to work together as to when the good time is, and if there's any precautions we need to take or any special treatment we need to give. So we probably liaise with your physician, but on the face of it, if you're able to maintain a kind of normal life, then I wouldn't have thought it would have a significant problem in you having a breast augmentation in itself. Sorry, Zoe, you come back at me. Thank you for that. Would you just have an uplift if that happened then, or would you need the implants removing? Good question. Would I yeah. So Zoe, by all means, you can send photos by private message, and I can have an idea. It's always difficult. I can give you an idea. Sometimes often there's nuances to what you have done, and so it's hard for me on a photo to say you need to have this, you need to have that. But I can perhaps give you an idea if that's helpful. But if your breasts have fallen off the implants, then an uplift would make the breasts bring the breast back onto the implants. So your question, would you need to have the implants removed, is a good question. It would kind of depend on two things. First of all, if there's any problems with the implants, the main problem is going to be capsular contracture, which is scar tissue forming around the implant, which makes them go hard. And that would be also dependent on the second thing, which is how long the implants have been in. So if they've been in a long time, 10 years or so, I haven't had anything. Oh, you haven't had, oh, so you haven't. Oh, okay, haven't had anything done yet. All right. So if they've been in a long time, then sorry, would you say do implants move if you have children after breast surgery? Okay, so you're just getting yourself sorted. So if your breast implants had been in a long time, then there would be an argument to change them. And particularly if they had any problems in terms of scar tissue and capsular contracture around them, there would be an argument to change them. But if they hadn't been in a long time and you had no problems with the implants and your problem was just a droop of your breasts, you could just have an uplift and you could just leave the implants in place. I did that operation not that long. Well, I saw the patient recently. I probably did it a few months ago, but yeah, it's if it's just the shape that's the problem and the implants are kind of sitting there and they're not causing any issues, then you could just do a lift to tighten the skin of the breast and bring it back onto the implants, and you could potentially leave the implants in place if there was no issues with them. But if there was issues with them, or if you've had them in for a long time, you might choose to have the implants changed, which could be done, or removed altogether. That could also be done. I was just wondering whether you should wait until you've finished having children. Yeah, I mean, the advice is if someone's thinking of having children and thinking of having any kind of body contouring, really, but particularly breast and abdomen, because those are the two areas that can be affected by having children, then you are best off waiting till afterwards, because the surgery can change the shape having children can change the shape of your breasts in an unpredictable way. Sometimes it doesn't do much. Sometimes they get a lot bigger. Sometimes they get a lot bigger, then they get a lot smaller and they droop. It's unpredictable what happens to your breasts. So ideally, if you're having surgery, then you really want to have it on a sort of stable platform. You don't want to be having it with something that might potentially change in the future. And so ideally you would have the surgery once you have finished your family. So once you've finished your family is the ideal situation. Some people don't, because it might be many years for that to happen, but as long as you go in with your eyes open, that having children can affect the size and the shape of your breasts. So if you're spending a lot of money on it, you might want to think about getting the best result, which might be when you've finished your family. So that might be something to think about. So yes, sorry about the early one today. Just had to do a bit of juggling, bit of jiggery pokery at home, and so I've had to start early. But early start, early finish, and so I will sign off unless Zoe or anyone else has got anything to say, and I will be back next week. I think probably next Tuesday. So if you've got any questions, message. I put a post on Instagram saying click the link, but I couldn't work out how to put a link in. I'm sure there's a way of, what is there, like Zoe knows, messaging and things. Just do messages, direct messages and stuff, and I will be very happy to answer your questions this time next week. Sorry, Corin. I meant to put a post out to say it was early, and then I got to the time when I was going to have to start, so I didn't put that post out. Sorry about that. Even though I put a post out saying it'd be at 7 o'clock, I know I did that, which I don't normally do, but it just shows you, doesn't it? Zoe, I'm just wondering on prices, but I will private message. Yeah, do that, Zoe, because I've got no idea about prices. So so presumably breast implants is it you're thinking of in the first instance, but by all means private message and we'll send you details. If you send us your email address, we can send you details about whatever it is, breast implants or whatever it is, breast lifts. I think it's implants, is it? Whatever it is, we can send you details about it. Thanks, Corinne. Yeah. Good to see you tonight. So yeah, I will, on that note, sign off, and I'll be very much looking forward to seeing you. Thank you, Zoe. Thank you for participating. Thank you all, and I will stop the